The following presentation is Group 2's representation of short-term memory treatment. The treatment is focused on the client named Jane. Jane is a 27-year-old female who sustained a severe TBI following a motor vehicle crash 3 months ago. Her medical history indicates that she has a very involved family, including 2 brothers, a mother and father, a rich network of friends, and a fiancé whom she is engaged to be married to in the summer of 2017. Jane has some patient goals including returning to work, living alone, passing a driving test, socializing with her friends, and planning her wedding with her mother. Some of these patient goals are not attainable in Jane's current state. Our group thus focused on planning her wedding with her mother as an obtainable goal for Jane to focus on short-term memory. In order to understand what the short-term memory treatments are for, it is critical to understand the definition. Sometimes called primary memory, short-term memory is stored knowledge. The second stage in some models of memory in which information can be maintained by rehearsal. Without rehearsal, information decays within a few minutes. Short-term memory has limited capacity. Only a few items of information can be stored there at one time.
Jane is getting married this summer. She hopes that she will be able to help her mother plan her wedding. We created a long-term goal focused around this request. Jane's long-term goal is the client will be able to use a memory notebook on functional tasks in the adaptation stage with no clinical instruction. The clinicians will obtain this goal by using information feedback, cueing, and repetition strategies. We chose a memory notebook after reading Evidence-Based Intervention for Impairments of Memory by Rebecca Eberle and Cognitive Rehabilitation Following Traumatic Brain Injury Assessment to Treatment by Theodore Tassides and Wayne Gordon. Memory notebooks are tailored towards the client's specific needs, but often include memory logs, calendars, to-do lists, transportation information such as maps and public transportation schedules, a feelings log, and names and identifying information about other individuals. Jane's memory notebook will also include a wedding section to focus on her final goal. Here are 3 important stages to using a memory notebook for treatment. The acquisition stage is when the clinician focuses on the name, purpose, and use of each section. Our treatment plan will be focused on this section. The application stage is when the clinician does activities to use the notebook on functional tasks in the clinic. The final stage, the adaptation stage, is when the client is able to remember to use the notebook in naturalistic settings outside the clinic. In order to track Jane's use of the memory book inside the clinic, we will use a scoring system of 1 through 4. 1 being when the patient does not initiate use of the memory book, all the way to 4 when the patient does not need any prompting to record or retrieve information from the memory book. Once the client is consistently at a 4, we will move on to the adaptation stage of therapy. Before we can work up to Jane spontaneously using the notebook to plan her wedding, we must provide a foundation for the purpose. After providing templates for the client, we will go through each section one by one and talk about the purpose and use. For example, in the medical calendar section, there will be a list for her future doctor's appointments. Before the therapy session, we will obtain a list of future appointments from her parents. Then we will ask her what type of information will go in this section. If she answers correctly, the clinicians and Jane will practice filling out the section with her future appointments. After going through each section, we will ask questions such as, in what section of your memory notebook do you plan personal activities? In what section do you record future appointments? When should you review what you have recorded in the book? When should you write in the memory log? The book will be reviewed multiple times with similar questions asked after each section. If Jane does not understand a section, we will spend time talking about it in greater detail.
Short-term goal number 1. The behavioral objective is that the client will use visual memory to identify pictures of family and friends with 80% accuracy with minimal clinician prompting. The strategies used will be clinician modeling, cueing prompting, and information feedback. The approach to treatment will be using flashcards and matching games. This task will assess immediate memory, primary memory, and rehearsal. The procedure for this task will be to present the client with several pictures and ask her to identify important individuals from a spread of miscellaneous pictures. These pictures will include family members, friends, especially those who will be at the wedding. After doing that, the next step will be to present the client with person-specific pictures. She will then be asked to describe the individual in the picture. Following the description, the photo will be flipped over and Jane will be asked to recall the details of the photo from memory. Lastly, repetition and rehearsal will reinforce the faces, names, and descriptions of these important individuals. For this procedure, for this goal, it is important to begin with familiar faces and names, then progress to more unfamiliar people, such as distant acquaintances. These tasks will also test attention and concentration, which is an important factor to observe considering her level 6 orientation. For the describing task, the clinicians may increase or decrease the number of details to be recalled as necessary. Utilizing repetition with all of these tasks will help strengthen the connections between faces, names, and descriptions, which will be essential in social situations and at Jane's wedding. As for scoring, correct responses will be marked with checks, incorrect responses will be marked with dashes. For cueing and prompting, verbal prompting may be given to help give context for the pictures or to jumpstart Jane's memory. As for the rationale, it's important for short-term memory to acknowledge the stages of recognition, immediate memory, and primary memory. This goal focuses on identifying familiar faces and names of important people in Jane's life. Being in stage 6, Jane should already be recognizing faces. So we will be working on immediate memory and primary memory to strengthen her response feedback. By focusing on familiar faces and names, Jane will be more comfortable in social situations, specifically her wedding, meeting at least 2 of her functional goals.
Jane has mentioned how important it is to her to be able to plan her wedding with her mother or to be able to hang out with her friends. Being able to make lists and remember the items within the list can aid with these 2 goals among others. The goal of this task will be for Jane to be able to remember at least 5 out of 6 items by using semantic association techniques. As to carry out these goals, the intervention strategies used will be the following. Modeling. The clinician will show Jane how to carry out the task by performing it before her. Cueing or prompting. Whether the prompt be verbal or visual, some kind of cue will be provided if Jane seems to get stuck. And information feedback, an answer as to why the performance was good or needs to be improved with a simple explanation as to why. The treatment approach will include flashcards, association tasks, pictures of faces, items, and/or animals. As we now have the basic information of what this task entails, we can expand on the process followed for it. First, we would explain the task to Jane and model it by using semantically simple concepts tied to semantically simple categories. For example, we would show Jane the picture of 6 animals: dog, cat, snake, gecko, ladybug, and beetle. And we would explain that there are things that might allow us to categorize these animals in smaller groups according to certain similarities among them. After this explanation, we might propose the categories of mammals, reptiles, or insects, and write each one of them on a separate flashcard that we could later place separately on the table. We would then place the pictures of the dog and the cat underneath the mammal flashcard, the snake and the gecko underneath the reptile one, and finally the ladybug and the beetle underneath the insects one. We would then claim we have 90 seconds to try to remember those items. Now that thanks to the smaller chunks, it is easier. After 90 seconds, we would take the picture away but leave the flashcards and regurgitate the items within each one of the smaller lists. After modeling, we would show, for example, 6 pictures of foods and ask Jane to think about categories that the words can be divided into. We would offer cueing if needed for the categories. For example, these two are a type of food that come from the sea, to prompt the word seafood, along with errorless training if a mistake is anticipated. We would then write the categories agreed upon on 3 different flashcards and arrange the pictures underneath the categories they belong to, and offer Jane 90 seconds to pay close attention to the resulting list. After the 90 seconds, we would take the pictures away but leave the flashcards. We would leave the flashcards only during the acquisition phase, and once the task became clear to Jane, we would update the task to using categories mentally rather than a visual way as to not have Jane fully rely on prompting. We would then ask Jane to recall the items by using the categories in front of her and provide cueing and informative feedback as needed. We would repeat the process with semantically simple concepts until Jane seemed fully comfortable with this strategy. Finally, it is worth mentioning that it is very important to apply this strategy taught in therapy to relevant topics in Jane's life, as to increase motivation and effectiveness. In order to achieve this standard, we could ask Jane's mother if she could provide pictures of Jane's friends from different settings, for example, work, school, or neighborhood, and use the semantic categorization strategy for names. Another idea would be dividing things that she needed to do for the wedding in categories of what the end goal is. For example, decoration, food and drinks, and ceremony. As the goal is to remember 5 out of 6 items, the scoring of this task will be fairly simple. Correct responses will be marked with checks, incorrect responses will be marked with dashes, and number of correct versus incorrect responses will be computed after the task is finished. This task is based on evidence-based practice and research exploring the effectiveness of internal strategies in the treatment of memory. Short-term memory is a key type of memory in the recall of lists. Eventually, the client's goal will be to use semantic association techniques or chunking in naturalistic settings. As mentioned before, this strategy can be used to help her plan her wedding with her mother or remember the name of their friends, along with many other things.
As clinicians, we do our best to bear a client's personal goals in mind. That being said, Jane's goal of living independently is both unrealistic and unnecessary, since she will soon be living with her spouse. Her goal has been modified to the ability to perform a few basic personal and household maintenance tasks independently. Compensatory intervention strategies will allow for deficits in short-term memory, while also giving the option for more freedom from the task prompts in Jane's memory notebook. Here are 2 compensatory strategies which will support Jane in 3 common daily tasks. The client and clinician will work together to create hard copy instructions to add to the memory notebook, and will also set reminders in Jane's Google Calendar or similar application as a reinforcer. We are going to focus on Task 1, selecting an outfit for the day. In this daily example, Jane can practice getting dressed by using a paper cutout doll. This doll and her clothing pieces can be kept in a pocket of the memory notebook. To prepare for her wedding day, Jane will have a bride doll with bridal clothing, corsetry, and accessories that can mirror her own bridal ensemble. Jane will practice with the doll, then use the doll to cue herself on how to get her outfit together in the right order. Jane's goals involve increasing accuracy from week to week. She has 2 weeks to learn the tasks and get used to instigating these tasks when prompted by her Google Calendar alerts on her smartphone or tablet. Jane scores a 1 if she reacts to the smartphone or tablet prompt and goes to retrieve her memory notebook to begin the task. She scores a 0 if she does not react or reacts inappropriately by not retrieving her notebook or starting the wrong task. There are a total of 15 prompts in the course of a week.
Short-term goal number 4. Jane will correctly recall important addresses and be able to locate them using Google Maps with 80% accuracy. The treatment approach is spaced retrieval therapy using telepractice. The rationale behind this task is to help orient Jane to location and prepare her for arranging transportation to important event locations, for example, doctor's appointments and wedding plans. She most likely will use the GPS function on Google Maps when traveling by vehicle or walking and needs to learn its basic functions and how to find the address she needs in her memory notebook in case of an emergency. We will use space retrieval therapy by telephone to reinforce the information to be remembered. Before using the space retrieval therapy, in the therapy room, we will teach Jane the addresses she wants to remember. We'll also teach Jane to use Google Maps on her cell phone or tablet, and we will save these key addresses in the Google Maps application. The SLP will call Jane once a day for 7 days. Each session will last 40 minutes. This space retrieval therapy done by telepractice is based on evidence-based practice found in the references section of the presentation. We will rehearse the location information for 9 minutes, 3 minutes per address. Rehearsal will consist of the client hearing the addresses and repeating them aloud. After rehearsing the addresses, Jane will be asked the following questions, which she can answer from memory or from remembering how to find the answer in the computer application. She'll be asked what is her home address. She'll be asked what is her fiance's address. What is her wedding venue address? Where is her SLP's office? And how long does it take to get from the SLP's office back home? All of that information should be found in her Google Maps application. The multidimensional scoring will consist of 3 points for the correct street number, street name, and city, with 1 additional point for knowing travel time, 2 points for 2 correct aspects of addresses, and 1 point for 1 correct aspect of the address. Prompt questions will be spaced out during the 40-minute session. The SLP will ask Jane the prompt questions at 1 minute, 5 minute, 10-minute, 20-minute, and 28-minute intervals. The SLP and Jane will discuss other topics in between the prompt questioning period.
All right, Jane, so for our first activity, what we're going to do is we're going to look at some pictures. So I'm laying 5 pictures out in front of you. What I'm going to tell you is a name, and I want you to see if you can find the face that matches the name, all right?
Okay.
Can you find the picture of Tim? You're right. This is a picture of Tim. Who is this a picture of?
That's Tim.
You're right. And Tim is a singer. Who's the singer?
My fiance.
You're right. What is his name?
Tim.
Excellent. So there's a man in this picture and he's singing. Do you know his name?
It's Tim.
You're right. Excellent. So what I'm going to do now is I'm going to leave you with 1 picture and we're going to describe that picture, all right?
Okay.
Okay. So let's look at this picture. Do you know who that's a picture of?
My mom.
Excellent. Do you know your mom's name? It's okay. You can take your time and think about it.
I don't remember.
Her name is Hannah. Okay? So this is a picture of your mom. Let's look at the description of your mom in this picture. I see that your mom has long blonde hair. I see your mom has blue eyes. And your mom lives in Greensboro. Can you look at that picture and tell me some things about it?
It's my mom.
You're right. Can you tell me about her hair color? What color is that?
It's blonde.
Mm-hmm. What about her eyes?
They're blue.
You're right. And where does your mom live?
I don't remember.
Well, your mom lives with you. Do you know where you live?
Here?
Mm-hmm.
In... I don't remember.
You live in Greensboro. Where do you live?
Greensboro.
You're right. And your mom lives with you here in Greensboro. Where does your mom live?
Greensboro.
You're right. So now what I'm going to do is I'm going to flip the picture over, and I want you to tell me some details about it. What do you remember about that picture?
It's my mom.
Mm-hmm. What else? What about her hair color?
It's blonde.
You're right. What about her eyes?
They're blue.
Mm-hmm. And where does your mom live?
Greensboro.
Mm-hmm. Can you tell me flip it over, look at it again. Can you point to some of the features? Can you show me her hair? Her blonde hair? Excellent. And can you show me her blue eyes? Excellent. Well, let's flip it over again. Tell me some details about the picture.
It's my mom.
Mm-hmm. What else about it?
She has blonde hair.
Mm-hmm. What else?
And blue eyes.
Can you tell me anything else about the picture?
Her name is Hannah.
Mm-hmm. And where does she live?
Greensboro.
You got it. Excellent work. All right. So, our next activity, we're going to talk about something very important to do, and that's getting dressed in the morning. So, we're going to use a paper doll, and we're going to help her get dressed. But she's getting ready for a special occasion. She's getting ready for her wedding. Do you know anyone with a wedding coming up?
I do.
You do. You're about to get married. And so what you're going to do before you get married is you have to get dressed and you have to put on your wedding dress. So we're going to help our paper doll get ready. What do you think the paper doll is going to put on first? We have underwear, bra, and a dress. Which one would you put on your body first? You're right. What's that called?
Underwear.
You got it. And where would you put the underwear? Excellent. What did you just put on her body?
Underwear.
Underwear. What else would go on her body? You're right, but maybe not first. I think her dress will come last. What goes before her dress? What would she wear underneath it? You got it. What's that called?
A bra.
You're right. So what is she wearing right now?
Underwear.
Mm-hmm. And what else?
A bra.
You got it. So what is she going to put on next? You're right. What is that?
It's her wedding dress.
It's her wedding dress. You want to put her wedding dress on her? Excellent. So what is she wearing underneath her wedding dress?
I don't remember.
Let's look. What is she wearing?
Her underwear.
Mm-hmm. What
and
else?
A bra.
You got it. What goes over top her underwear and bra?
Her wedding dress.
You got it. So she's ready to get married. Are you ready to get married?
I'm ready.
Girl, we'll get you ready.